Memorial Chapel and Cox and Graziano Funeral Homes. Jennifer is here to discuss a sensitive subject we all need to talk and think about. Here now is Jennifer Graziano and Time to Talk.
Good afternoon, Westchester. It's 12 noon on Wednesday, and that means it's time to talk with me, Jen Graziano. I'm a licensed funeral director who oversees my family's funeral homes, Cox and Graziano of both Mamaroneck and Greenwich, and the Zion Memorial Chapel of Westchester. Every Wednesday, I come to you discussing important topics and sensitive matters that all of us need to pause and reflect upon at some point. And through this show, I hope to provide the platform to do so. If you are joining us this afternoon on 1460 WVOX, welcome, and thank you to Gerald in the control room, making sure my hair was in place in the headphones. I appreciate it. Good looking out. And welcome back, Facebook Live viewers, our second show of the day. This time with the guest, though, so I promise you it's less of my voice, which I think you'll appreciate if you tuned in for the first show. And hi, Tim. Thank you for being with us. So I'm joined today by Alyssa Prete. She is a therapist and mental health counselor, and she recently opened up a practice in Mamaroneck called Knot Clover, which I think is an interesting name. I want to find out why she calls her practice that and a little bit more about the services that she offers. I think raising awareness to mental health issues at all ages is so important because our children are struggling younger, people are struggling older, and perhaps we've always struggled, but we're just more aware and we identify more. So there is no shame in getting help. The problem only comes when we don't seek help. So hopefully through this show, you'll learn a little bit more about this wonderful resource. So welcome, Alyssa.
Thank you, Jen. Thank you so much for having me.
Of course, always happy to have friends of friends on the show, but you came highly recommended. And honestly, admittedly, I was struck by the title of the practice. So it's not Alyssa Prete, licensed, mental health counselor. It's Knot Clover. Why did you call it this?
Right. So I felt Knot Clover best represented my services because a knot is a symbol of strength and interconnectedness, and clover, to live in clover, means that you live a life that's more carefree, prosperous, and that's what I work to do with my clients. I want to give them the tools to live a more carefree life, and then similarly with the knot, I really focus on their strengths as opposed to identifying weaknesses. So it's really a collaborative relationship.
And a knot can also represent a struggle. I mean, when we're tied in a knot, internally and emotionally, we can be stuck. We can be unable to move. So it's actually a really interesting dichotomy, the two terms, because once you work to get past that internal knot, you can be liberated. So even more so, I think the name ties in well together.
Thank you.
Can you tell us a bit about yourself and where you were practicing? It's a big leap to go into private practice. Yes. So tell us a bit about your background and how you felt comfortable to do so.
Mm-hmm. So for the last 4 years before I jumped into the practice, I was working at Mercy College in the counseling center there. And then I worked at another college counseling center before that, and I worked in other people's private practices. So it was really through the college that I saw that there was a need for this emotional preparation for the college experience. There's a lot of focus on academic prep, like getting your kids into school, hiring someone for SAT prep, help write a personal statement, but not focus on the emotional preparation that's needed for this experience. And oftentimes it's the first time that a kid is away from home. And if they don't have coping skills and they're not prepared for this, it can be a really difficult experience. So kind of seeing the gap in my work in colleges was where I was like, okay, I think that this is needed and I'm really passionate about this, so I'm going to take the leap and do it.
It's so true. We always treat a person as a whole, no matter what age they are. And, we're quick to get our children help for every little thing. Like we'll tutor them, we'll get them a tutor if the academics are falling. If they have some type of sports injury, we get them to an orthopedist. But the struggles are real and identifiable. And we had this discussion prior to going on air. It's a different world than kids are growing up in. And you being very young, I mean, I'm sure what you see going on in high schools and middle schools is so different than your day. The pressure is stronger. The college admission process is stronger. There's a whole area devoted to college admissions and academic prep to get them ready for this. So why not have this area devoted to maintaining the adolescent's mental health? Because if you don't treat issues then, they're only going to compound. Anything left untreated will need to be treated at some point. It's just a difference of what you're treating and how far gone a condition gets. So you will see patients as young as 12 years old. That's
Yes.
where you begin.
Mm-hmm.
Is it family counseling as well? Do you look to explore the family dynamic? Because again, I mean, yes, we're all individuals, but we're part of something larger.
Mm-hmm.
So
Yep.
I'm sure you can't effectively counsel the individual without the whole. Am I correct?
Right, especially when they're that young, you really want the family members to come in and when they're comfortable, because it is the safe space for the child if that's who I'm treating. So when they're ready, having the parents come in, siblings even, usually in my intake, which is the first session that I meet with someone and get, the whole background, what's brought them in, goals that they want to accomplish. I'll get parents' perspective and then the child's perspective, and then kind of have them sit in together and figure out what's been going wrong, what do you want to see change. So it's definitely, the family is involved in the process for sure.
How far off usually are the perspectives between the parents and child? How far off? I mean, do you find that we're really not that far off from our children, but sometimes we just need someone to help bridge the gap?
I think so. Yeah, I don't think it's that far off. They might have a little bit of a different perspective. It's a teenager. They're like, "Why are you smothering me?" Or what's, but it's certainly the concerns are real.
I'm going to save your card for my daughter. She's a little young, but that question comes up at 7. But no, I absolutely, as a mother, I wholeheartedly believe in what you're doing, and I think it's wonderful, and I want to help spread the message that you're here. Let's talk about where, obviously, your 12-year-old client is not going to be suffering the academic stress. It's not the college prep time. Mm-hmm. What do you find are some of the identifiable markers or concerns or things that are impacting younger children today? Is it that 12-year-olds, have iPhones, social media and social interactions? What are your findings?
I think definitely social media plays a big role in this. It's not like social media is bad, but I think it's important when kids are that young that parents monitor what they're looking at and how often they're on the screen. Because one of the things, certainly self-esteem and body image, you're going to have these comparisons to these people online, and they don't have the knowledge that a lot of this stuff that they're seeing is edited. It's Photoshop.
Right. No one looks that good.
No, exactly. So that's one danger of that. And then the other is we're so communicative right now with Facebook messaging and Instagram and texting. So we're talking more than ever, but we're not having this real human connection. We're by ourselves behind a screen doing this. So it's really important that you limit the screen time and get your kids out there playing with friends and hanging out with people, because we are seeing a rise in social anxiety as well, because kids don't know how to interact with each other and they don't know how to carry conversations, and when they're older they don't know how to make friends in college or talk to professors. So
it's a trickle-down effect. Moral of the story, get a sled and go outside today and go ride in the snow. I would like to do that. I'm almost 40 years old. I would totally do it if given the opportunity. What I think one of the interesting things here is there's so much less of an opportunity for parents to stay connected to what's going on. So when I was 12 years old, if somebody called for me, they would have had to go through my mother or father who answered the phone. So they would have known who was on the phone. You don't necessarily have to know ever who your child is talking to now. And that is so dangerous. We preach in this world, don't talk to strangers. We still teach our kids that. That's like the first lesson in preschool. But yet we turn our backs when they're on a computer communicating with somebody across the world who's at a ridiculous age and they shouldn't be talking to. So it just unravels, the don't talk to strangers was at the basic foundation of what we taught our kids. And there's so much loss of control, and there's such an advancement where there's too much freedom too fast. And at 12 years old, you probably see things that just causes you to scratch your head to say, how can this child be in this position? The good news is if they come to you that age, you can start the process of fixing this. So when you have that issue of that very young adolescent and the social media concerns, when you step in, what do you do?
So I talk to them about what they're looking at, what they're finding, how it's making them feel. And I really try to encourage them to talk to their parents and to be open about what they're looking at and to have dialogues with them. I tell my kids when they come in, if they're under 18, that if they tell me certain things, I can't keep it a secret. If they tell me about substance use, self-harming behavior, suicidal thoughts, anything like that, I'm not going to keep that from mom and dad.
Right. Well, there's probably a mandatory reporting.
There is.
Okay.
Yes.
Okay.
And anything else that's concerning, if they're watching something that they shouldn't be on YouTube or anything like that. So we really try and create an open dialogue and get them to understand mom and dad's concerns about the social media and how to limit it for themselves, so that doesn't feel like they're putting, mom and dad are telling them what to do or that they're being punished, but how to limit it for themselves and what to put in place of those kinds of behaviors.
And at least they're seeing a reason behind it. I mean, I'm
Right.
I'm of the generation where you didn't need a reason; it's just because mom said it, and that still applies. Like, and I use that line of logic with my daughter. I catch myself sometimes, but just because I said so.
Mm-hmm.
But maybe having the child see the reason makes the parent more real and
Mm-hmm.
human-like, and,
Yes.
and it's not just a matter of obstinance and saying no. Well, here's the reason that they're saying
Mm-hmm.
that. So open communication, expressing what they're feeling, having them telling you what they're seeing or what they think they're seeing.
Mm-hmm.
You probably know this so well through your work. Suicide amongst adolescents is alarming.
Mm-hmm.
And when you stop and think, why didn't they just go and speak to someone for help? There's so many resources available in a school or through home, and they were so loved. And I have watched, as a funeral director, the immeasurable pain that parents go through. It's something I don't even like to speak about. It just stirs up so many memories. But what do the adolescent mind is a different mind. It's not fully developed. You're not dealing with this rational 40 or 50-year-old. How do you make the child feel like, they're not isolated in their world. They're not a stranger in a foreign land, that they are supported?
Mm-hmm. I think it's important to normalize the experience, normalize what they're going through. You're not alone in feeling depressed. You're not alone in feeling anxious. This is a really tough time for kids now. I mean, we didn't have the pressures of social media and technology, even the academic pressures and the competition there that they have now. There's so much pressure on them, and it might be easy to write it off and say, oh, they're being, hormonal, grumpy teenager, because it is a rough time. But it's very important to notice the child's behaviors, if there's anything concerning that you see a switch in, and to just build a real connection, genuine connection with the teenager, and say, I understand you, I'm not judging you, and this is totally normal what you're going through, but we want to get you feeling better. Suicide is the second leading cause of death in college students, so it's really, really important to give them some coping skills, help them build their resiliency, and let them know that they can reach out and they're not alone.
You validate them.
Mm-hmm.
So among your, so you do counseling, but among your technique is a call to mindfulness and meditation.
Mm-hmm.
We hear mindfulness all the time. It's just become part of our lexicon, and meditation is just something that so many of us it's suggested that we do. How does it come into practice for you, Alyssa?
Mm-hmm. For me personally?
Oh, for in your practice,
practice.
How do you introduce mindfulness and meditation to your clients?
Mm-hmm. So I think first, kind of like demystifying it. I think a lot of times, especially younger kids, when they hear that, they think it's like hippy dippy, woo woo.
And you're sitting like Indian style.
Yeah, exactly. Yeah, with incense and all that stuff. But it's really just, if you kind of introduce it to them as a stress reduction technique, it's something that actually really helps you calm down and stress less and be more present in the moment. So Koru Mindfulness is actually a program that was developed specifically for the emerging adult age range, although it works for other people as well. It's they started it for 18 to 29.
Okay. And what does it entail? Is it a type of meditation?
It's a stress reduction program for that age based on mindfulness and meditation. So what they were finding with the other forms, like just the general mindfulness-based stress reduction, is it wasn't really addressing the developmental needs of this age group. It was too time-consuming because, kids, their schedule's packed. So this program, it's a very structured curriculum. It gives them some homework assignments to do on an app on their phone when they leave the session, and it's just 4 weeks, 75 minutes once a week. So they learn some deep breathing techniques. They learn the psychoeducation, the science behind it, and some stress reduction techniques as well. And they're in a group. It's a group setting, so it's nice for them to interact with other people too.
And is this something that you offer at your practice?
Mm-hmm.
Okay. So let's move on to the parents now. Is part of your client base older adults and parents that are coming to you independently of their children?
Yes. Mm-hmm.
And it must be this, I think every parent struggles that they're not doing enough or that they're not good enough. What is your advice to parents, who come in there alone? Do you encourage them to try to bring their child in, or what are the different sets of coping skills that you give to parents?
Mm-hmm. To let them know they're doing the best that they can. There's always room for improvement. We've been seeing, especially when I was working in the college, this kind of helicopter, quote unquote, parenting style, where you might micromanage your kids' schedules and do everything for them. And that doesn't mean you're a bad parent. That's your parental instinct. You want to protect your kid. You want to shield them from feeling any ounce of hurt or pain or struggle. But when you take away, these opportunities for growth, these everyday struggles, you're not helping them to build resiliency, build the coping skills. So when you're just a developmentally appropriate task to give your kid, my sister's a kindergarten teacher, and she tells the parents, have them zip their coat, learn how to zip your coat by yourself, pack your lunch that mom or dad made you in your backpack before you go to school, and then give them increased responsibility as you go. Don't make their doctor's appointments for them after a certain amount of time. That's one thing that was common.
Give them tools.
Give them tools.
To deal.
Yeah.
Yeah.
You want them to feel confident and happy when they go off to college, that they know what they're doing. But parents are doing the best they can. This is a really rough time to have kids with all this technology, and I think everyone's just, trying to do what they can to keep their kids safe.
Alyssa, what contributes to a lack of resiliency in teens or young adults? Everything seems like the end of the world. It's never going to get better. And, it's easy to chalk it up to say, okay, they're dramatic and hormonal. But again, you're trying to bridge the gap of understanding.
Right.
What contributes, though, to that lack of resiliency and hopeless feeling that many teens feel?
Mm-hmm. I think it's some of the parenting style. If mom and dad were taking care of everything and you're kind of, left to your own devices and you're like, oh my gosh, I don't know how to do laundry. I don't know what kind of insurance I have to make an appointment. So some parenting, I think technology and social media too, that kids just aren't interacting as much. They don't know how to address teachers or professors or have conversations with each other.
Look someone in the eye.
Yeah,
so important.
There's so much academic pressure on them these days. I think it's a whole multitude of factors that are contributing to how they have this kind of lack of ability to cope. And then, like you said, everything turns into a crisis situation. Things that we would consider normal everyday struggles that you're going to have to deal with. If you don't like a roommate, you get into a fight with a friend, you got a bad grade. It's this huge deal, and they need it taken care of at that moment. This kind of instant gratification too.
Yeah, and not to impose my own thoughts on the world, but I think it's such a disservice, this over coddling, because life is not fair and life is not easy. So you need to learn that really, really young. And it's not to say life is bad, but you are going to be in situations where you don't like who you work with.
Right.
You're going to be in situations where you don't like who you marry. You have to figure out how to get a divorce. Life is not fair, and life is nowhere ever what you forecast it to be.
Right.
So you need the ability to adapt, adjust, change gears, deal, and cope. And it's alarming, just kind of at least the blanket way that teens are perceived nowadays, or the way what we see out there, like the millennials, as we hear a lot. It doesn't look like they have that skill set. So it sounds like what you're trying to do is catch them before they become that stereotypical millennial.
Exactly.
Who can't really cope with much. But we'll save that for another show. We could do a whole theme on millennials. So Alyssa, in your practice, you're helping by psychoeducation and custom plans that are based on 4 areas of wellness that you break down to social, emotional, together, mental, academic, and physical. again, we're one person, and a huge part of this, again, goes back to the academics. You do a lot to focus on the anxiety that comes into play with college. It's so different. I mean, when I applied to college, you just applied. You fill out a questionnaire. You took an SAT. Do they have SATs anymore? You would know.
Sure.
They have SATs?
Oh, yeah.
Okay. Are they still based on, like, they're like the math and the arts and science, or math and arts?
So.
Yes.
Out of 1,200 points?
The points
I think it's 16 now.
Oh, they found more points?
1,600.
Okay. All right, we have more points now. But then they had, like, the specialized, like, the ACTs, were, like, subject-specific. But that's not enough anymore. It's not just going to college. This is, you begin talking about college in your freshman year. So what do you do in that academic realm to help them?
Try and keep things into perspective. It's okay. You don't have to go crazy joining every club, acing every exam. I mean, there's so much stress they can become paralyzed with it. Just encouraging them to do the best that they can. And you're going to figure it out. It's going to be okay. You're going to get into college. You're going to be prepared, but you don't want to have that time where you should be enjoying yourself and being a kid just totally about academics and stressing out all the time. It's not good for them.
The rest of your adult life to be a nervous creature. So,
Mm-hmm.
and you know, I can look back at the people who go to the top schools and who stress themselves out, at least from my frame of reference. They're not more successful than other friends of mine who went to lesser known schools, if they went to school at all. So once you get out of school, it's all up to you at that point. Your degrees don't mean much except for a nice little decoration on your wall. It's what you do outside of there. And again, you're giving the street smarts, the life skills, and anybody can read a book and spit back out what they just retained, but it doesn't get you very far. So you're implementing a strong foundation that these adolescents can emerge into functioning adults.
Right. Exactly.
Through your practice, do you ever get to an older generation? Do you find that comes into play?
Yeah, I really enjoy working with adults as well. When I first came up with the idea of the practice, this is what my main focus was, but I also really enjoy working with older adults as well.
Do you find that no matter what age, we're all kind of bound together by this commonality that we all worry, everyone struggles, everyone worries?
Absolutely.
And you can be a bridge to kind of help break down what we're worried about and perhaps deal with it. I mean, it's not that there's not cures really, but there's just ways to deal. Would you say that's true?
Yes. And I think it's helpful to know, like, we're all in the same boat. We all are just doing the best that we can. And the more that you know that, the less alone in your struggle you feel, the less isolated, and the more likely you are to reach out for help.
Alyssa, can you talk a bit about depression? I just think it impacts so many, and I don't know if it's because the word is overused or, in fact, it's underused for people who just chalk up, I'm just feeling a little down, a little sluggish. You know, how do you define depression from your perspective as a therapist?
So depression, we usually diagnose if you've had 2 weeks or longer of a depressed mood, changes in your sleep and appetite, the sluggishness that you talked about, fatigue, lack of energy, loss of interest in things that you usually enjoy or that bring you pleasure. For kids, if you notice a change in their behavior at school, their grades, social isolation, those are really kind of the main, and then of course, any feelings of hopelessness or suicidal thoughts, anything like that you notice that's a change that could be depression. And sometimes it's unpredictable. Like you said, if you are just feeling sluggish and not necessarily like, I don't feel sad, but there's something off.
There's something
there
off,
could be
right.
something there.
And at any age, this can come into
Any
play.
age, yeah.
Really? I mean, do you see a lot of young adolescents with depression?
Unfortunately, yes.
And what do you do at that point? Do you try to, is it do you suggest going to the next step to a psychiatrist for medication? Or do you just try, at the younger ages, try to implement the skills to deal?
First, we want to always try to implement the skills. We don't want to bring them directly to medication, but medication certainly helps people. It changes the brain chemistry, and sometimes that's what they need to make even the therapy more effective. But definitely trying the skills, seeing what we can do for them first. And sometimes it's enough for some people to even just have someone to talk to and just kind of word vomit and just talk about how they've been feeling. So that's always the first step.
Do you see that depression is more, is it genetic or is it more environmental?
I think it's both. That's a tough one.
Yeah.
That's always kind of like the
It can
debate.
be either, though.
Yeah, it can be either. It can be a combination. It's always that like age-old debate, nature versus nurture in psychology. If you've taken psychology classes, but I think it's definitely a combination of both.
So, Alyssa, your practice is Knot and Clover, and we're somewhat neighbors. You're down the street from me on Boston Post Road, great little shopping center there. Do you have a website, a phone number? How can our listeners and viewers learn more about you?
So my website is knotandclover.com. You can find all my contact information there. My email.
Not and A-N-D?
Yep.
Okay. No, that's important too, because my website, Cox and Graziano, you have to remember, spell out the and. Not K-N-O-T and A-N-D, Clover, C-L-O-V-E-R. And a phone number for you?
It's on. I actually don't know it off the top of my head. I just made it.
No, I get that. I totally get that. So go to the website, Knot Clover.
Yes.
And
my email.
Okay. So people can go on, learn more about you, call to schedule an appointment. But I do encourage everybody who has watched or listened today, help is here, help is attainable, and there's no shame in asking for help. And don't make your pride spill over to your children, and I think for some parents that's very hard. Get them talking young, get them opening up young, help them young, you'll help them for the rest of their life. So I thank you.
Thank you, Jen. Thank you so much.
I wish you a ton of luck. This is a great thing that you're doing. I think you'll do very well. And this is Jen Graziano thanking you all for taking the time to listen as we took the time to talk. Have a great day, Westchester. Bye-bye.